Hey guys, how are you doing? You're welcome to today's episode. I'm Dr. Nimirungi Tumusiime.
And I'm Dr. Kiiza Blair.
Yeah, so today we're going to discuss about cesarean section. This is a very common myth surrounding situation. So maybe we shall first describe what exactly is a cesarean section, and then you talk about why is it that nowadays we're having very increasing rates of C-sections as compared to before, our grandmothers and all those. So what do you think a cesarean section is, Dr. Blair?
So a cesarean section is that mode of delivery where instead of you pushing naturally, you're now being cut. So you're cut because you have failed to push, and that's why we are resorting to cutting you. But as we go into the discussion, we shall get to see the different reasons why some fail to push and they end up getting a cut. So it's going to be a very interesting discussion, and I hope you hang in there so that you don't miss any single bit of the information you're going to share. Dr. Nimirungi, over to you.
Very true. So first of all, I think the thing that tends to have a lot of myth is why exactly are we having increasing rates of cesarean sections? Like people will be like, why is it that our grandmothers never used to have cesarean sections? Were they better women, or were they stronger women, or were they more womanly than the women now that are having cesarean sections? So I think we're going to try to get some of those myths and say what it is that we think about them. Why do you think we're having increasing rates like lately?
I think every time we're having advancement in healthcare, it comes with a lot of atrocities. Every time we have a lot of specialists out there, they're pressured. Some of them are pressured to try and do what they're trained to do. So you find that these days we're having a lot of unnecessary cesarean sections. I'm not saying that all cesarean sections are necessary, but you find that people are being cut just because someone wants to. That for me, I don't feel I have the energy to push. And that alone is warranting a doctor to offer someone a cesarean section. That is interesting. So a choice by someone has never been an indication for a cesarean section. But these days you find that most of the C-sections are driven by someone's choice. That for me, I want to push. The pain is too much. So all those things, when you tie them up alongside with the pressure with some malicious doctors to make money, you find that has a lot contributed to the increasing rates of cesarean sections.
Very true. Very true. And actually, I think also in addition to that, by the way, it's like recently, the World Health Organization now actually legitimized that if someone actually has a choice to have a cesarean section according to their wants and needs. However, there's also the theory of natural selection. So most times you find that with improvement in the healthcare system that we have, so when you have like medications are getting better, facilities are getting better, it also implies that people are also going to have increased rates. So back in the day, or in the years that were passed before these advancements in medicine were done, we would have that when someone was going to deliver, if they didn't deliver vaginally, they would die during childbirth. And so when that would happen, that gene pool would go with that person. So that information of that human being would not be captured. The same way how, let me say, we had people with sickle cell disease wouldn't survive in the past. But because now we have advancement in healthcare, we have more people that are living to survive to older ages. So so you find that women who are having the gene pool or the predisposing factors to a C-section, let me say things like someone who can't push, so the bones, like when the bones are not accommodative enough, the pelvic structure doesn't accommodate vaginal birth. So then they would have to be scissored. So now those ones who would be able to push would die. So that's also one thing.
Can I interest you in some important facts? Did you know that actually when you trace the history of these cesarean sections, it actually has roots within Africa?
Really?
Yeah, when you look at history in the early 18th century,
yes, by the way.
Yeah, we had the Egyptians doing those cesarean sections. Even here in Uganda, the Bunyoro, we had specifically those trained people who were trained to do the cesarean section. They had special knives. They had the whole setup. They didn't have what people call the chloroform, the one that makes you sleep with anesthesia, but they used to use this local alcohol. So they intoxicate you with alcohol, they put you to sleep, and they cut the baby out.
Imagine intoxicating me actually pregnant. It's crazy.
So at least back then, they only used to resort to that when you've totally failed to push kabisa. Not like a choice, because no one would want to go there because it was painful, because me giving you alcohol doesn't take away all the pain. So you'll still feel some pain, but then most people will only go there if totally they have failed everything. And I feel like instead of not giving a woman a chance to deliver vaginally, and then you just rush to do the cesarean section, it's very unfair.
Yeah. True. And that's the thing also, like these days we have a lot of laws and legislations around these things. Chances are, if you're going to allow a mother to try to monitor her and allow her to have a vaginal birth, some mothers actually insist and say, I want to have a vaginal birth, whatever it takes. But now, if you begin to see any sort of abnormality, any sort of delay, the thing we're like, you know what, let's just go and have this thing out, because at the end of the day, it's no longer heroic to push.
Yeah.
The only thing someone needs is a healthy baby and a healthy mom.
Definitely.
Because even when we would have the older days when we would have these cesarean sections that were done locally and all these things, the side effects, the complication rates were like skyrocketed. As we're going to see things like sepsis, the bleeding, people would die during childbirth and all these things. So that is one thing. Now, speaking of sepsis, actually, we have a lot of like post-op sepsis, like patients who complain they got infections, actually not even them complaining, but like we see some hospitals where you find someone gets like infections post C-section, and they actually now have to stay much longer in hospital, or even some die from these infections. What do you think causes them?
So I think, I totally believe from the practice that I've done is that we are having facilities that are doing this cesarean section that are not up to standard.
Sure.
You find that most of the medical clinics we're having on the roads, on the streets, in the villages, in some way or the other, they're offering those cesarean sections. It's not a theater that is up to standard, but you find that people are actually operating there. So what happens from that? What happens is there's a very high likelihood that if you enter that theater, you get operated from there, you actually stand a very high chance of walking out with an infection. And that's what people have not invested in. You find a very big hospital, it's now maybe attacked with a very particular bug. There's a very bad bacteria that is roaming within the hospital.
And with resistance,
With resistance. And then the hospital is not doing anything. The only thing they're doing is just taking everyone to theater. But whoever walks in that theater gets an operation, they're actually ending up with a very terrible infection. They're most likely dying from it. So it doesn't make any sense taking someone to go have a procedure. It's successfully done. Maybe it was a baby that we're taking out. Maybe it was any other disease. Maybe there was a tumor that was sitting in there. And then after taking that thing out, or maybe the baby out, someone dies shortly after the procedure. It's very absurd.
Very true.
Yeah.
Very true. I think also actually in addition to that, there also, however, number one, of course, we have like we work in the setting that we work in has a very wide variety. Like there's some people who are really in like really low resource facilities, and then some who are in like average resource facilities, and some who are like in high resource facilities, or stroke well equipped and rich facilities. However, I have also seen some cases whereby you find someone, they're in an average facility, sterility is maintained during theater, everything is on point, it's crisp and clean, everything, but still someone gets sepsis. I think also these cases are there, and the thing that I attribute to that is the fact that we have a lot. So I feel like post-op sepsis is something that's multifactorial. Number one, for as long as you have a cut or a breach, because skin itself is a barrier for everything.
Sure.
So as long as you have a cut on the skin, you're always at risk. That means every patient should be informed that this is a risk that could happen.
By the way, picking from that, there are some practices that actually put women at risk of actually walking out with an infection. When I was in northern Uganda, they used to get some funny herbs and they used to smear on every wound, even if it's just a new even surgical infection. They do actually in Western Uganda. They do that a lot. They smear cow dung on a wound, on a fresh cut. What does that bring? Definitely infection.
Tetanus, not to forget. Although of course they have the immunization, but still, I feel like that exposure is a bit much. But also the we have a lot of situations whereby you find sometimes like some mothers also. So these, I think the factors are like we said, multifactorial. One, some people even personally, the immune system is just compromised. So someone is at a very high predisposition. Number two, of course, pre-op and So preoperatively, intraoperatively, and postoperatively, the facility has things that they're supposed to make sure that they are put in place. For example, preoperatively, we normally give prophylactic antibiotics, and we'll give you an antibiotic to make sure nothing exactly happens. Then before a cut is put, even before the blade is placed in you, again, you're re-sterilized over your abdomen. Actually, I was in a facility where we were practicing, and the women had to shower with Hibitin, the antiseptic, and you shower with Hibitin. Make sure you got into theater when you're like already, the process has begun. Then we would now scrub you with iodine, and then even the way that we scrub you is a particular way. And then when we get in there, now we make sure everything that we use is extremely sterilized, and we use like autoclave machines in very high temperatures and do all these things. Then even during the procedure, if anything happens and you're breached, like now mothers will begin moving their hands and they're trying to touch the site and all these things. Sometimes some people will give you, some doctors, some practitioners will give you longer course antibiotics depending on the level of breach that has been there. And then also post-op ambulation. But I don't know, maybe tell people the essence of beginning to move as soon as you can.
So we find that most people actually, I think they have what we call self-pity. Someone has been cut, but they feel like they can't move anymore. You know, every time you have a surgery, you have to move. The earlier you move, the better. You're saving yourself from clots. You're saving yourself from the infections you can get because you're in the same environment all the time. If you can begin showering as early as possible, the better. You find someone, they have a wound, just because it is sealed, they don't want any water to come in contact. For even if it's 5 days after the surgery, they're just covering it all the time, covering it. And even what you cover the wound with is very, very important.
Very true. And also, like, of course, not to put aside the fact that, yes, it's true someone is in pain during post the surgery. So sometimes this can be the limitation. And that is why you are bombarded with the highest, strongest pain management, so that you get out of bed as soon as possible. Right?
Very, very important. So just before we cross over to the next segment of our discussion, so someone out there will be wondering, what should they look out for so that they can be protected from getting these infections after the procedure, or what should they make sure that is in place so that they are protected? What do you think, Dr. Nimirungi?
I think first of all, the facility in which that like you're getting this procedure done, number one, the procedure is very important. So like first of all, the clinic, some people will go to like these facilities. For example, I have practiced in like 4 government hospitals, and the practice in government hospitals is in its way the way it is. You also can't blame the practice because the patients are so overwhelming as compared to the health workers that are there. And so you begin finding that at one point, actually at one point I remember, like uterine rupture is like one of those things that are like the worst complications. I remember one time we were in theater and we had like 4 mothers that had ruptured. Like one, literally you can see the limb of the baby like over the abdomen, and they are walking like 4 are in a line. Then you're having other 5. These ones, so at one point you can be like, even there's no more like triage. It's just whoever comes in, we go. But of course, some facilities have precautions. Some facilities have precautions that are taken to make sure that these infections are prevented. But some don't really, and then some have better than others. So it's a whole kind of like situation like that. So now another thing that maybe people tend to ask about is this thing, mothers who have had C-sections, like the first baby, they really want to get a chance to push. Like they really want a chance to push. And of course we have guidelines that keep changing, but of course we have our risks. Exactly. What can you tell them about this vaginal birth after C-section or trial of labor, like just trying and all this? Who qualifies for it? What are its risks?
So when it comes to, if you have had a cesarean section before, for example, you've only had one cesarean section, you actually stand a chance of pushing the baby subsequently. Or maybe your second baby, you can't push actually, but not essentially that it's definitely true that you push, but you should be given a chance to push if that moment comes. But women who qualify for that kind of avenue where you're given an opportunity to push when you've had a cesarean section in the past are women who actually, if the baby, the space between the previous pregnancy and the one you're carrying now is 2 or more years. The reason why you give it two or more years, because we are trying to aim at the other wound that was put on the uterus to have healed at that time.
Properly.
Yeah, so that at least there's some strength when it comes to the uterus. Because the biggest risk when it comes to pushing after cesarean section is every time you try to push, you have a scar on the womb. So when you try to push and push, the baby is trying to, to force its way through the lower part of the cervix, what they call the nirvana. But given that the tension is spread along the entire womb, that scar can break, and then you find the baby's gushing through the wrong area. So we usually want to give some at least 2 years before we can, give them an opportunity to push again.
Very true.
Then number two, we tend to look at what was the indication back then for the first C-section. If the indication was that the bones were too compact down there that the baby's head couldn't fit, then I don't think that can change after 2 years. Then definitely we'll have to give you a cesarean section for the second time.
Actually, now even before we leave that same point, I actually had a mom who one time I delivered in some referral hospital. But the thing actually first she was an outlier for that indication, because for her actually, by the time she had her first baby, she was 16.
Oh.
So when she was 16, her bones were still
tight.
Now the next time, by the time she had baby number 2, when she came, she was now 25. So now actually so we were like, okay, let's give us a chance. One, at the time, let's assume that one, she was young and the bones were still compact. But number 2 also, the time lapse, like the time it was over 5 years. Like when you get it. So the uterus was quite well healed. And the bones were like, maybe they have grown also a bit to a more womanly stature. So she actually succeeded. It was very beautiful, an experience. But definitely, if you've been already, you're a grown woman, and then when they go to assess your pelvis, it's not something that is possible. Chances are, even for the next one.
Yeah, we'll apply cesarean section.
Yeah.
So you find that's very, very important. You find that some women are actually forcing it. But I had a C-section, I don't want to be cut again. It's not a choice. Sometimes we have to do it because it's the only thing we have to do then. It's a healthy baby, right? So I think, time is very important between the first cesarean section and the pregnancy you're having. That's why we usually advise women, if you've been cut, please use family planning for at least 2 years.
Very true.
Because if you end up getting a pregnancy within the first 1 year, or maybe in less than 2 years, chances are high that the scar hasn't really strengthened very well. So you can have actually terrible complications. I'm not saying you'll definitely have, but you stand a chance of getting terrible complications. The risk is still there.
And also there's this thing that there's this thing like mothers, some people or some mothers get offended when someone says you delivered naturally versus you delivered by C-section, i.e., it's like saying that someone delivered by C-section is kind of saying she's less of, exactly. Like that, first of all, I feel like that doesn't make sense because number one, or someone says delivered normally, there's some terms that people find quite offensive. But even us, like in the medical world or in the medical field, we have criteria that we term as a normal delivery, like what is normal and what is not. So even someone who has like prolonged labor, someone who delays by any short, someone who you have to induce, just anything like that will make you, I don't want to say disqualified. What term would you use? But like it doesn't be normal, but also assisted.
It's assisted. Yeah, I would say we give it a little push. Though I think we should stay away from using the word normal because even a cesarean section is normal delivery.
Is it though?
It is. I mean, you've delivered normally. The only difference is the in-betweens are what has changed. Because you who was pushed, I would say spontaneous, you pushed without any aid. But you find that cesarean section, we've done it because it was the right way to deliver you, because it was your only way.
The best way.
But every time you use terms like normal, abnormal, CG natural versus artificial, for you didn't do it the natural way, and you find some people actually offended by that, would rather stay away from such terms. I would rather use the word you delivered vaginally and you delivered by cesarean section, as simple as that. Why
do I also feel like so there's a number of moms or new moms that feel bothered by being asked, what way did you deliver? I don't know. As a woman, I don't think I would be offended by what way I delivered, because at the end of the day, my baby being healthy and me being healthy is like the most important thing. Doesn't matter if I pushed or I didn't push. Okay, now you as a man, if your wife, would you think less of your partner if she delivered by cesarean section? Would you feel like she's less of a woman?
Definitely not. Nothing takes away her womanhood from a cesarean section.
True that.
So that's why I'm saying it's very, very important not to stigmatize women.
Very true.
Basing on the way they delivered. A baby is a baby. If you had a cesarean section or you push vaginally, it's all the same. You're all having healthy babies.
Very true.
And someone who has pushed, it's not a sign of strength or resilience. You're not stronger than someone who has a cesarean section.
Just your body.
Yeah, because this one has had to withstand the anesthesia. They've taken away her pain. They had to inject her in the back. She has also withstood all that.
Yeah.
And she has also, it's more or less the same. So actually, some people even believe that if you have a cesarean section, you won't love your baby as compared to someone who has pushed. Yeah, if you get your baby through pain, you tend to love or have more connection with your baby compared to a cesarean section. I don't think that's true.
I really don't think so, but also especially I don't think so. I think maybe because we are biased, because we are medical workers, but I feel like a healthy baby is a healthy baby.
It's a healthy baby.
That's the only thing that really matters. I don't think I would want anyone to feel stigmatized by the fact that they delivered by vagina or they delivered by C-section.
Yeah.
It's just kind of a whole strange phenomenon to go
Definitely.
by. But anyway, I think that is kind of it, right?
Yeah,
Do you
it
have anything
is.
else you want to add or to tell the moms?
Honestly not. But what I would say is always attend your antenatal care.
Very true.
Antenatal care is very, very important.
Religiously.
These things of showing up, 9 months pregnant, we don't know what to do with you.
The same things.
It's never the same. There's no experience in pregnancy. Even if you had 2, 3, 4, 5 pregnancies, always attend antenatal care for each and every pregnancy that you get. Because they find that, these women who have had like 3, 4 pregnancies before, when they get like the 5th pregnancy, they don't want to attend antenatal care.
I feel like they're the chairman of
you get. And then they're showing up 9 months pregnant, something has changed. Maybe the baby now the legs are facing down. Maybe there is something abnormal on the baby that would have picked up maybe early enough. And now you're showing up 9 months and you find that such things are the ones that actually bring in atrocities. You find that, you're either having a very bad infection, maybe you're having a very bad tear down there, or maybe the baby is not coming out the way we would have wanted the baby to come out as a healthy baby. Yeah.
I think at the end of the day, a healthy baby and a healthy mom is the goal, and that's just it. Otherwise, you guys, do not forget to come for the Med Expo 7th to 9th of September. We shall all be there. We shall have different people, different specialists that are going to be around. Please make sure you attend. You'll ask actually much more questions.
Yeah, I know, right?
We shall consult different people at just 5,000. It's just
5,000 only.
Okay.
1, 2, 3, 4, 5.
Is it even lunch?
It doesn't make lunch in Kampala, but 5,000 like this. Turn up, tell a friend to tell a friend. Let's be there in big numbers.
Yeah, big numbers.
Thank you.